Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. It is Medicare open enrollment, and I wanted to share this information because, look, we all get there at some point, and it's important to understand how this stuff works and the resources you have. Before I jump into it, a free resource for you, free, doesn't cost you a nickel, is Chapter. I have partnered with Chapter to provide you the information that you need with regard to anything with your Medicare. So reach out to them. Their link is in the description below and in the comments. Just go down to the part where it talks about Medicare, and there's a link there for Chapter. Reputable, solid, and they can help you with everything that you need. Now, open enrollment for Medicare October 15th through December 7th of each year. And again, if you have any questions regarding anything with your Medicare, reach out to Chapter. Now, generally, Medicare is for people 65 years of age or older. You may be able to get Medicare earlier if you have a disability, end-stage renal disease, or ALS. Medicare has 4 different parts. So let's talk about Medicare Advantage. I found an article here on The Motley Fool, and it's 3 reasons to choose a Medicare Advantage plan during open enrollment. Again, information's free. Reach out to Chapter, have a conversation. It's that easy. All right, so the key points here are going to be Medicare Advantage is an alternative to original Medicare that typically includes drug coverage. Medicare Advantage plans commonly offer extra benefits beyond what original Medicare gives enrollees. In some cases, your costs under Medicare Advantage may be cheaper. All right, so let's go ahead and jump into this. There are benefits to signing up for one of these plans. If there's one expense that could wreak serious havoc on your budget in retirement, it's healthcare, and that's one of the reasons why I always talk about how important it is to try to get to that 50% level and higher on your VA disability compensation, because then it opens up the VA healthcare system vastly more in your favor on the healthcare side. All right, so moving forward, as people get older, health issues tend to arise. And even if you do a great job of looking after yourself, you still may find yourself running to doctors and specialists more often than you'd like. One way to keep your healthcare costs more manageable is to choose the right Medicare coverage. And now, it's the perfect time to do that. And this is why this open enrollment period happens every year. You can go in and change things around if needed. Medicare's fall open enrollment period is currently underway, and it is now until December 7th of 2025. Existing Medicare enrollees can make changes to their coverage. That could mean switching from Part D drug plan to another, or it could mean signing up for a Medicare Advantage plan for the first time. If you're not familiar with Medicare Advantage, it may seem like a whole new world. As an overview, Medicare Advantage plans are offered by private insurers and are required to provide at least the same level of care as original Medicare. Medicare Advantage plans typically include drug coverage, making them a convenient and effective way to manage your health. Here are some of the reasons you may want to choose a Medicare Advantage plan this year during open enrollment. Number 1, you can get extra benefits. There are a number of important healthcare services original Medicare won't cover. These include dental exams, vision checks, eyeglasses, and hearing aids. Having to pay for these services yourself in full could eat into your retirement savings. The good thing about Medicare Advantage plans is that they offer supplemental benefits beyond what original Medicare covers. This means you may be eligible to cover for coverage for dental cleanings, eye exams, glasses, and hearing aids. On top of that, Medicare Advantage plans commonly offer health and wellness benefits. These can run the gamut from gym memberships to meal delivery services. Because no 2 Medicare Advantage plans are the same, it's important to review the benefits offered by each plan you're looking at before making a choice. But if you find a plan with a lot of great benefits you'd qualify for as a patient, then it could pay to make a switch. Number 2, you may not have to pay a premium. A good number of Medicare Advantage plans have a $0 monthly premium. That said, Medicare Advantage enrollees still have to pay a Part B premium. But moving on to a $0 premium Medicare Advantage plan could be a cheaper prospect than retaining coverage through Original Medicare. These especially hold true because this especially holds true because it's common to need a Medigap policy in conjunction with Original Medicare. But if you don't have to pay a Medigap premium and can get a $0 premium Medicare Advantage plan, it could put more money in your pocket and help you stretch your retirement income further. Number 3 here, this is the last one. Number 3, your out-of-pocket costs will be capped, which is important when you're on a fixed income. All right, so when you're retired, and it says it. When you're retired and on a fixed income, that consists of savings and Social Security, unexpected healthcare expenses can be scary. Another nice thing about Medicare Advantage is that it sets a yearly limit on your out-of-pocket spending. Original Medicare, on the other hand, does not have a limit on out-of-pocket spending, leaving you vulnerable to huge bills. I'm going to throw it out there again before I continue. If you are a veteran, and look, for those of you that are service-connected, good. But there's 70% of us out there that are not. So you take 10 veterans, well, guess what? 7 probably are not going to be service-connected for anything. And I think that we can all agree that most people would at least have something. And when I say most, who knows what that number is, right? 50, 60% of veterans? I don't know. But the longer time you're in, the more likely you would qualify for something on the disability compensation schedule. In some cases, you qualify. Some cases, you actually could qualify for VHA, Veterans Healthcare Administration benefits, healthcare benefits, without being service-connected. So you don't need to be a service-connected disabled veteran in order to get healthcare. There are other qualifiers that could qualify you. So it's one of these things to where you don't know until you know, and that's what this is all about, right? Hitting the thumbs up, subscribing, sharing with friends, all of that stuff. It's just important to share that information. Anyway, let's move on. So it says here that, but even if you had to buy that Medigap policy, you may find that this feature of Medicare Advantage gives you more peace of mind as you try to stick to a retirement budget. An option worth considering. Medicare Advantage plans aren't perfect. They commonly limit enrollees to a specific provider's networks and often require prior authorization for screenings and services, a process that can sometimes delay care or result in the denial of care. But it pays to at least explore your Medicare Advantage plan options during open enrollment. If you find a plan that works for you, it could result in big savings. So with that, I really do appreciate you watching. Reach out to Chapter, find out what your options are, what things look like during open enrollment. And with that, thank you so much for watching. Have a great one. And remember, if we don't take care of each other, something went wrong.